Diagnostic terms. So first, angiography is radiographic imaging of blood vessels. Angioscopy is visual examination of the blood vessels. Aortogram is a radiographic image of the aorta. Arteriogram is radiographic imaging of an artery. Venogram, radiographic imaging of a vein. Echocardiogram is the record of a heart, shows the structure, the motion, blood flow using ultrasound. An electrocardiogram is a record of the electrical activity of the heart, also known as an ECG or an EKG. Specialties and descriptive terms. So, specialties, cardiologist is a physician who studies and treats diseases of the heart. Cardiology is the study of the heart, medicine that deals with the heart, diseases of the heart. Atrioventricular is referring to the atrium and the ventricles of the heart. Cardiogenic is originating from the heart, and intravenous is pertaining to within the veins. Here are some more disease and disorder terms. These ones are not built from word parts. Acute coronary syndrome is a sudden onset of symptoms related to unstable angina or myocardial infarction, basically symptoms related to insufficient blood supply to the heart muscle. Aneurysm. An aneurysm is a ballooning or a weakening of a portion of an arterial wall. So the wall of the artery gets weak and it balloons out. Angina pectoris is chest pain, which may radiate to the left arm, the jaw, that occurs when there is insufficient supply of blood to the heart muscle. Arrhythmia. An arrhythmia is any disturbance or abnormality in the heart's normal rhythmic pattern. Cardiac arrest is a sudden cessation of cardiac output, which will prevent circulation to the body. Requires CPR. Cardiac tamponade. Cardiac tamponade is acute compression of the heart caused by fluid accumulating around the pericardial cavity. So the fluid presses on the heart. Coronary artery disease. Coronary artery disease is condition that reduces flow of blood to the coronary arteries that supply the myocardium or the heart muscle with oxygen-rich blood. Coronary artery, deep vein thrombosis is a condition of a blood clot in one of the deep veins of the body. Most often occurs in the lower legs, typically related to other disease processes like atrial fibrillation or immobility. Someone's not moving around a lot. Disease and disorder terms continued here. Fibrillation means quivering. So you can have fibrillation of one of the chambers of the heart or all of the chambers. If you have ventricular fibrillation, then you can't sustain life. Heart failure is the condition where the heart isn't able to pump enough blood to maintain circulation to the tissues or organs. Hypertensive heart disease is disease of the heart related to chronic hypertension, can cause structural changes, muscle overgrowth, so cardiomegaly, cardiac hypertrophy. Intermittent claudication is caused by a lack of blood supply to the lower legs when walking, so not enough blood gets through the arteries in the lower extremities to meet the demands during walking, and then it goes away when they rest. That's why it's intermittent. Mitral valve stenosis. Stenosis is narrowing of the mitral valve, so myocardial infarction is death to some cardiac tissue, a portion of the myocardium caused by a lack of oxygen or blood delivery, an interrupted blood supply to the heart. MI, also known as a heart attack. Peripheral artery disease is disease of the arms and legs resulting in narrowing or obstruction of the arteries of the peripheries. Varicose veins are distended veins usually found in the lower extremities, often visible from just looking at them. Big swollen veins. Some surgical terms. Artificial cardiac pacemaker is a battery-powered apparatus implanted under the skin in the chest, and there are leads connected to the heart to override the electrical activity of the heart, used to treat abnormal rhythms of the heart, typically slow rhythms like bradycardic rhythms. And it'll send an electrical stimulus every second or so to initiate a heart contraction. Automatic implantable cardiac defibrillator is similar device placed under the skin connected to the heart that can detect lethal rhythms like ventricular fibrillation or ventricular tachycardia and can actually defibrillate the heart and shock it hopefully back into a normal rhythm. Catheter ablation, procedure in which abnormal cells that trigger abnormal heart rhythms are destroyed using a device that heats or freezes those cells. So they'll put a catheter in through a large vein and then actually take a look at your heart, find out where the abnormal cells are, and they'll destroy those cells in hopes that the rest of the healthy cells will take over and lead to a normal rhythm of the heart. Coronary artery bypass graft, also known as a cabbage, is a surgical technique where they bring new blood supply to the heart by detouring around blocked arteries. So if you have some arteries that are completely blocked, they can take a vessel from your own body, like maybe your leg, or from a donor, or maybe another, like a pig or something, and they can bypass that blocked artery by placing a new vessel in there to supply blood to the heart muscle. A coronary stent is a supportive scaffold device placed in the coronary artery to prevent the closure after they've opened it up with angioplasty. So they'll open the valve back up that's been occluded or partially occluded with a balloon angioplasty, and then they'll put a stent in there, which is a device that keeps it open. Percutaneous transluminal coronary angioplasty, or PTCA, is a procedure in which they use a balloon and it's advanced up into the coronary arteries, and they will balloon open a vessel that's been narrowed, closed, blocked, obstructed. Thrombolytic therapy is medication they can put into your veins, intravenous medication that will dissolve blood clots. So if you have something like a heart attack related to a blood clot or a stroke, they can dissolve that blood clot with medication known as thrombolytic therapy. Some tests we can do: check somebody's blood pressure using a sphygmomanometer. It's a device used to check the blood pressure. Blood pressure is the pressure exerted by the blood against the arterial walls. It's measured in systolic and diastolic pressure, so usually written systolic over diastolic. The systolic pressure is pressure during contraction. Diastolic pressure is pressure during relaxation of the heart. Your pulse is the amount or the number of contractions felt within a minute. It can be measured using your fingers placed over an artery. You can feel it and count how many pulse beats in a minute, or you can use an ultrasound also to listen to it. And then you have some labs here. Lipid profile is the amount of certain types of lipids or fats in your blood. So triglycerides, lipoproteins. Troponin is a blood test that measures the amount of this enzyme known as troponin in the blood. It's released during cardiac injury. So an elevation in troponin means that heart muscles have been injured. Hypercholesterolemia, so excessive amount of cholesterol in the blood. This increases your risk for cardiovascular disease, stroke. Hyperlipidemia is the excessive amount of any type of fat, so lipoproteins, triglycerides, cholesterols. It's known as hyperlipidemia. Hypertension is increased amount of blood pressure. So typical blood pressure is 120 systolic over 80 diastolic. So once you get up to about 130 for systolic and 90 for diastolic, we can call it hypertension or higher. Hypotension is a low blood pressure. So typically around 90 systolic and 60 diastolic, we'll call it low blood pressure or hypotension. An occlusion is a closing or a blockage of a blood vessel or a hollow organ. Some more disease and disorder terms. An embolism is something that blocks the flow of blood through an artery, a blood vessel. It can be a blood clot. It can be foreign material. It can be air or fat gets lodged inside a blood vessel. A hematoma is a tumor of blood, a collection of blood that's leaked out from a blood vessel. So it's typically like a swelling or a lump filled up with blood. Hemorrhage is to bleed excessively internally or externally. Anemia is a decreased amount of a blood cell product. So you can have erythrocytopenia, which is a decreased amount of red blood cells. Leukocytopenia is a decreased amount of white blood cells. Thrombocytopenia is a reduction in blood clotting cells, platelets. And pancytopenia means an abnormal reduction of all blood products. Some diagnostic terms. A complete blood count is a test where they draw your blood through a vein and they put it in the lab machine that detects how many blood products are within your blood. So, measuring things like red blood cells, white blood cells, and thrombocytes. Hemoglobin. Hemoglobin is a certain red blood cell that carries oxygen. So, oxygen carrying capacity, hemoglobin. It's a blood test. Another blood test is hematocrit. So hematocrit is the percentage of red blood cells to the entire amount of blood that was drawn. Bleeding profile. A bleeding profile is a series of tests like a PTT, APTT, INR that determine how long it takes for your blood to clot. Bone marrow biopsy is a test where they use a needle to aspirate a solid portion of your bone marrow, typically in your hip, your iliac, and they can detect diseases and disorders of the blood or the bone marrow or certain cancers. A phlebotomist is a person who draws blood. Anticoagulation is a therapy we give to slow down the time it takes to form a blood clot. And blood dyscrasias are any abnormal condition or pathophysiologic disease process of the blood. Some more disease and disorder terms. Lymphadenitis is inflammation of the lymph nodes. Lymphadenopathy is disease of the lymph nodes, typically with enlargement caused by infectious process or cancer. Lymphoma is tumor of the lymphatic tissue. Splenomegaly is an enlargement of the spleen. Acquired immunodeficiency syndrome is a chronic immune disorder caused by the human immunodeficiency virus, HIV. Manifests as a decrease in immunology, so you're more at risk to infections and can't fight diseases, pathogens, cancers. Autoimmune disease. An autoimmune disease is when the body is unable to distinguish self cells from foreign cells, so it attacks its own tissue like it's fighting an infection. There are hundreds of autoimmune diseases. Some of the popular ones are like rheumatoid arthritis, scleroderma, lupus disease. Anaphylaxis. An anaphylaxis is an allergic reaction that's exaggerated. So a severe allergic reaction, your body encounters an antigen such as a bee sting or peanuts and will have this massive immune response causing vasodilation, swelling, can lead to like occlusion of the airway, drop in blood pressure, death. All right, and we can finish it off with some abbreviations. BP, blood pressure, CBC, complete blood count. ECG or EKG is an electrocardiogram. Echo is an echocardiogram. TEE, transesophageal echocardiogram. AICD is automated implantable cardiac defibrillator. CABG or CABG is a coronary artery bypass graft. CPR, coronary pulmonary resuscitation, cardiopulmonary resuscitation. PTCA is percutaneous transluminal coronary angioplasty, and a WBC is white blood cell count. All right, so this was a long video. This is a long chapter. It's full of a lot of very important, very interesting medical terms. So I definitely think you should start by reading the chapter, trying to understand all of this. There's a lot. So get to work and let me know if you guys need any help. Good luck.